So it is really a privilege to talk with you today and to kind of lay the foundation for what all three of us are going to talk about, which is how do we support ourselves, our colleagues, the people that really are doing incredible work. But incredible work in a set of very challenging times, and incredible work in partnership with children, young people, families that rely on us to be our very best. And in some days, I feel like I can be my very best and accept challenges and really dig in. But once in a while, I might feel a little bit beleaguered, stressed out, tired. And I imagine that I'm like the only one in the room that feels that way. So part of today is about how we help staff in supportive housing, but I think this talk is really about how we help each other and how we help ourselves as well, because we are the most important tool and the tool that is going to establish strong relationships with young people and their families and really help them on a journey that helps them be successful towards their own goals. So I'm going to try to see if I can get my PowerPoint up here because I'm going to just show you a couple of things. So my background is I'm a children's and family mental health provider by training. I'm a social worker, and so I'm very concerned about mental wellness of young people, mental wellness of their families and adults that are raising young kids. I'm also do a lot of work, Adina, thank you I do a lot of work around prevention of substance use, prevention of HIV, and so my whole premise of the talk that I'm going to give in just a couple minutes is it is really going to take a village. All of us, everybody in the settings that we work, the organizations that we work, including Consumer Voice, our young people and families, to really try to address the serious needs of families in supportive housing. And so part of the work that we do at McSilver is, in addition to being a social worker and trained in kids and family mental health, I'm also one of these really scary things. I'm a child services researcher. So those of you that have gone to a school lately, I know many of you, your favorite class was research. You were all math majors in undergrad, right? That really isn't usually who we are, right? We're very strong social science people. We're very strong in interpersonal skills and communication. It's why we chose what we did, right? Why was I so committed to applied research is because I care as a child practitioner, a family practitioner, what are the programs that, we're fielding, do they make any difference? Which youth are engaged in our projects and which ones really still fall off the map in terms of our programs. And I think that the typical academic way is that you would sit either at the medical school that Carol and I used to work at together, or you'd sit at NYU and you do research together. That really isn't our paradigm at McSilver, or was it Mount Sinai either. The notion is that if you're going to design programs, if you're going to design evaluation projects, young people, their families, communities have to weigh in, so you ask the right questions and you design the right services. And so I'm going to try to kind of give you in just a couple of minutes a few kind of programs and trainings that we've done across the city and now across the nation that we think are important sets of tools for workers to have. I have to admit that I'm a little embarrassed though, because my key colleagues from Palladia are here, and so Eddie and Emily taught me about all I know about supportive housing, and then I might have added a little value around how their staff and they could even do work and maybe bolster the work that they're doing even better. But it came from this community collaborative board of young people behind me and parents and service providers really weighing in around what will be helpful and most importantly what is not helpful about what workers actually do in their lives and in their homes. So we make some basic assumption that youth voice, family voice is incredibly important if we're going to design anything that's acceptable to our consumers, relevant to our consumers, effective and potentially sustainable in your setting. So those are kind of our basic assumptions, is that we bring something to this party, but our kids, our families really also can weigh in and really guide what we develop and what's helpful and what's not. Why do we need to embed mental health supports in services, in supportive housing? I would like to kind of at least submit, in my experience, that although you might make a lot of referrals, anybody make any referrals to community-based organizations? Right? Do they always go so well? No. So the original kind of notion was that in housing, we were going to have these strong linkages of community partners, and we were going to be vibrantly interconnected, and they were going to be so excited to see your families coming to their organizations, right? And then you sent kids to the child mental health clinic, or you sent your adults for adult mental health care, and what did some of our families do? Well, they did what families do, which is they don't come. They had other things to do. You sent them to 4 appointments on the same day. And then they got the letter. You had killed yourself trying to get kids into mental health services, and then they got a letter from the clinic saying, I'm sorry, you've missed 3 appointments. We can't serve you anymore. That's never happened to you, right? And so I think these referrals that we make are incredibly important, and that we do a lot of work with community-based providers to hold on to and engage some of the most vulnerable families. It's tough for them too. But we also have done a lot of work within housing to really bolster what the staff does to meet the very serious needs of kids and their families within your facilities, if you're congregate care, or in your scattered site programs across the city. Why is this important? I don't have to tell you, but there's lots of literature to suggest that your adults in your housing have tremendous needs. There's also lots of literature to suggest that kids have needs, and that typically, even though there's a lot of kids and family providers out there trying to meet those needs, very few kids actually get mental health care or prevention programs in a way that they need from our community-based providers. It's really you guys on the front lines if kids and families are going to get what they need in terms of clinical care. And so I'm just going to highlight just a couple of types of trainings that we have offered to supportive housing workers, both here in the city and nationally. And Eddie and Emily, you'll forgive me because you know all of these like backwards and forwards. But what's important about these particular services is they're a blend of 2 things. They're a blend of types of trainings and programs that have science behind them. They're likely to actually be helpful. But they also were created by kids and families very, very similar to yours. And that's important because sometimes you're getting training around evidence-based practices, and then you look in those journal articles, if we ever looked in those very scary methods sections, right? The ones that had samples and sizes and statistics, which we never look at, right? But if you unpack those method sections and those research articles around evidence-based practices, you will be guaranteed that those are not your families that those services were tested with. They are largely not families of color, not highly poverty impact, not multiply stressed and challenged families that have lived through what your families have lived through. So that's why we chose some of these in collaboration with our board, in collaboration with providers, is because at least they seemed more aligned with the work that Emily and Eddie and others were doing in housing. So I'm just going to briefly talk about family strengthening in the form of what we call multiple family groups, but this can also be individual work with families. I'm going to talk briefly about wellness self-management and evidence-based engagement, but I'm going to also give you a website at the very end where you don't have to write all this down. You can pull down these materials. You could figure out which of these materials would help and which will you're not that interested in. You might even hear a webinar that you hear Emily's voice from Palladia talking about engagement of families as well. So what are multiple family groups? They're an evidence-informed practice that really is meant to address the number one reason that you're referring kids for mental health care: they're struggling behaviorally. What's fantastic about kids with conduct difficulties is they are letting us know about the pain that they are in. Isn't that a really nice reframe? These are the kids that you know are really struggling behaviorally. They make every adult aware of their struggles. And yet we refer them for kids' mental health care, and I told you earlier that very few of those kids will actually get the help that they need. So what does one do if you're a housing provider, if you're a case manager? Do you let kids struggle? What multiple family groups and some of these materials do is they kind of decode what can a family do to help their kid who's struggling. And there's a lot of science around this. There's a lot of factors in a family that parents can engage in really new practices that help kids do well. What are some of the basics? So those of you, I can't ask you all who are parents, but let me ask, who's a parent? Have your kids ever struggled behaviorally? You don't have to raise your hand. There she goes. Mine too. Have they ever gotten in trouble in school? This applies to you too. That's the beauty of services where you have a consumer voice involved that says, families need this in housing, but so do we. And so the science base says if a kid is struggling behaviorally, it's really important how you parent them. It's really important to communicate. What happens when you have a kid who's struggling behaviorally is a lot of yelling goes on. I yell at my kids, you yell at your kids. It doesn't make a darn bit of difference if they're behaving badly, says the science. Right? Within family support is really important, but also so is our stress as parents. So is our emotional support that we have to calm us down so we can actually do probably the toughest job around, which is to raise our kids. All of this is really nice on a slide, but if you really think about it, it's all still kind of packaged in this academic way. Child management skills. Parents, that's what you do when you go home here tonight. Child management skills. No, you don't think about it. You're home, you're with your kids. And so families weighed in on this evidence base, and they said, this is way too complicated. You have to break this down. What can we do to help our kids? And they broke down the science base into 4 words that begin with R and 2 words that begin with S. This is pretty much the evidence base. If you're going into families' homes and their kids are struggling, places that you can help them evaluate where are their strengths in these areas and where are the places that they might want your help so that they can help their kids, in addition to trying to make a referral for treatment on the outside. All of us, all families have strengths in particular areas. Rules is probably the most important and the most challenging part of family life when you're raising kids. All of us have had a set of rules that our kids have followed, and many of us have had a set of rules that our kids consistently broke. Really hard to get a set of organizational kind of rules in a household. For families that are moving in from shelter, this is like really big. Because you went from an environment where many of the rules were externally imposed to moving into a home, and many families, whether they articulate it or not, are incredibly overwhelmed around how they reestablish a household where they're in charge. Particularly because they've been on a journey where lots of different experiences have undercut them as families and as leaders of their household. So rules is one area. Roles and responsibilities. What are parents' jobs? What are kids' roles in family? What's respectful communication? How do you get that going with a kid, particularly when you have adolescents in your housing? Because adolescents can be the kind of mouthiest of kids around, right? And respectful communication was actually named by a grandmother. She wanted to be sure, yes, communication was important, but it had to be respectful. Also relationships, positive relationships, stress and social support. Many times in this evidence base, if you can relieve families' stress, if you can help lower the temperature, their parenting capacities can emerge from underneath all the stress that have been kind of tamping those down. You can pull these materials down. I'll give you the website at the end. But there's a set of individualized activities that you can do with parents and kids. There's information that you can impart around the 4 R's and 2 S's. But what's most important is you can run it in a group. You can use it individually. But there's some science base that these areas, if you have a choice, focus in on building strength within your families because they're their #1 kids' mental health provider. You with me? Okay. So let me just go do two more really quick. There's something called wellness self-management that was rolled out by New York State Office of Mental Health. There's another version, Wellness Self-Management Plus. They all have related names. That was sponsored by Oasis, particularly for adults who are struggling with substance use. But the whole notion behind wellness self-management, it's an evidence-based practice that really was meant to help adults define their goals and strengthen domains of healthy adult life. So it's curriculum-based. So there are some tools that you can look at to see if any of those materials would help an individual family that you're working with. The topics cover a range of areas, but I think that if those of you that just like me struggle with how do you kind of work on recovery, how do you reinforce the recovery principles, how do you help adults make the best use of the mental health or the healthcare services that they have available, how do you help them think through physical wellness, mental wellness? There's some tools in wellness self-management that you might want to take a look at. There's also really important content around, we focus in a lot on problems. We are solving the latest problem of the day. And anybody dealing with a crisis or two? Right? It is really important you deal with those crises. It is really important that you keep people safe. But if you are going from crisis to crisis with your tenant, you're not building strength in terms of their capacity as adults and as a leader of their household. And so wellness self-management also helps you figure out how do you kind of, the next crisis, how do you rely and gather some support so that there's other people besides your case manager or your director that's going through that. How do you kind of build a healthy lifestyle that will put some space in between those crises? And so all of that's available to you as well. Finally, I'm just going to talk about engagement. Am I done?
Okay,
Okay,
no,
good.
you have a few more minutes.
Okay,
Wrap up. I'll be sure to give you your time.
Here I go. So I'm going to finally just say a few words about engagement. What I really appreciate about the work that you do is that there is some required contact with your tenants, but the vast majority of the services, they're voluntary, right? And so the assumption was that families would come into our housing and they would certainly meet the requirement, but they would be so happy to see Emily that they would want to take advantage of everything she had to offer. And then much to Emily and others' disappointment, as you go into this work, you realize that families actually turn you down more than sometimes they accept your help, right? And so it's a tricky thing because you have day-to-day sometimes contact, monthly contact with families, and yet you have to engage them in an intense way to take advantage of your offerings. When I went to graduate school, I had one class in engagement, and then I raced over for the rest of my whole 2 years as an MSW and worked on assessment and intervention. And I came away out of my MSW program thinking if I was nice, if I was respectful, maybe happy and sunny, because I'm from the Midwest. You can see the difference from New Yorkers, right? They hate happy and sunny. Right? That I was going to engage my families. In fact, there's a science base around engagement that I can't tell you all about it, but I can give you just a couple of little, oh, but it's going to go in slow, sorry. A couple of little kind of tidbits from that science. The first is that unless you and your family have identified a need that both of you care about, you're done. And many of our service plans are written from the needs of our program, the needs of what our supervisor tells us to do. They don't necessarily reflect your consumers, your family's needs. But in reality, unless you really can, from the family's perspective, identify a set of needs that they want to work on, this engagement thing is going to be, I'm going to open the door once a month because I have to. And this takes a long time in some cases, and a shorter time in others when we're really committed to helping our consumers talk us through what they would like their life to be like and how we can help them get there. The other thing is that folks, when you see them in your housing, they've been kicked around a lot, right? So even though they might express hope, because that's what we tough New Yorkers do, many of them look at you and say, are you kidding? I have tried all this before. I have seen you come, you go. Some workers have been better than others, most of them not so great. And so what particular interventions are you doing to infuse hope, to underline strength, to increase investment? Very purposeful behavior as you go into people's homes. We also talk through a lot with families their previous negative experiences. I used to try to cover this up. I used to try to pretend like I was the good worker going to clean up after all your mess. Right? I know that was really bad, but now I'm here. Forget all that bad stuff. In fact, it's the foundation of every interaction that you have is all those previous experiences. You'll have to unpack that for families, or they will look at you in the same way as they've looked at all their previous workers. Some of them have been great and others not so good. It is the key to help families talk about their prior experiences so you don't redo their past in your current relationship. We problem solve a lot. We try to give information that's useful. We try to be clear. This is much trickier than it appears. I must tell you that the more education I've gotten, the less my mother really understands what the heck I'm talking about. There is a lingo that we have picked up. It is our professional lingo. It's our program lingo. And many of our families are just like, whatever. Yes. Oh, yes. And so how you really check in to make sure the families are with you, incredibly important. Focus on practical and small wins. The more you can build your credibility around really being of use, that's important, and collaboration is key. So the only last thing I want to leave you with is that it's really important to think about how we're embedding clinical services in addition to referring out. I think that you guys are amazing tools to provide evidence-informed supports for our families. I think you have to be choosy about which ones you actually pick up. And I have unbelievable respect for the work that you do. So now I promised you a set of resources and tools. So there's two resources that you can pull down these materials. The one that I think is most relevant to you is I have the privilege of co-directing something called the New York State Clinic Technical Assistance Center. And it has a website, and that website is www.ctac, C as in cat, T as in Tom, A as in apple, C as in cat.com. There's webinars. I will. I'm going to say it one more time. www.ctac. So www.ctac.com. You can pull down the 4 R's and 2 S's. You can listen to Maya and Emily's voice on a webinar around engagement. You can see wellness self-management. All of these materials publicly available to you. And feel very free. There's a question and answer box that you can write to CTAC if you have questions about how to use it. So thank you so much. Thank you.